Hi, I'm Dr. Kimberly Hardy. I'm the Director of Nursing here with the Pitt County Health Department. I will be providing your pre-vaccination counseling for you today. There are a few things that we'd like to share with you. We gave you some paperwork when you signed in. You have 3 different documents, so I'd like to go over those with you. The first form that you had in your packet is titled Getting the Moderna COVID-19 Vaccine, What to Expect During and After the Vaccine. The first part of this form reviews the fact that the Moderna vaccine, which is a vaccine that you will be receiving today, is under emergency use authorization as approved by the FDA. The FDA authorized that in late December. That vaccine is authorized for use in people ages 18 years of age and older. This vaccine does require a second dose, and the second dose for you all will be 28 days from today. As you go to the clinic area, we'll tell you what that date is. I would like for you to go along with me and pull up your paperwork that you just received. The first sheet that you have is the Getting the Moderna COVID-19 Vaccine, What to Expect During and After Your Injection. I want to review just a bit of information that's on this form. In the first box that you see, it asks you some questions about your health when you completed the paperwork, and in this information sheet here, it asks you about allergies, it asks you about having a fever, it asks you about being immunocompromised, being pregnant, planning to get pregnant, breastfeeding, and having received another COVID-19 vaccine. I want to address those things briefly. If you have allergies, you can receive this vaccine, but there are 3 absolute contraindications. You cannot receive this vaccine if, 1, you have an allergy to polyethylene glycol or PEG. Polyethylene glycol is the active ingredient in Miralax and many bowel preps when you go and have a GI procedure or if you have a colonoscopy. So if you've taken Miralax, you probably are going to be okay with this component in the vaccine. If you have an allergy to polysorbate, you should not take this vaccine. Polysorbate is an emulsifier that's found in many medications, particularly ones that are over the counter. So if you've taken Tylenol, it contains polyethylene glycol. If you tolerate Tylenol okay, you should probably be fine with that component of this vaccine. The third contraindication to getting this vaccine, you don't know yet because you're getting your first dose today. But if after getting this dose today, you have an allergic reaction to it, you do not need to get vaccinated with another messenger RNA vaccine for COVID-19, okay? If you're sick today, do not get this vaccine. If you have a fever, do not get this vaccine. You need to wait to get vaccinated. If you are taking medications that act on your immune system and that may lower your immune system, we just want to make sure you understand that the medication or your immune status may alter how effective and how well your body mounts a response to this vaccine. So in short, being immunocompromised may decrease your body's ability to mount the antibodies to the coronavirus vaccine, which is the main reason for taking it, okay? It doesn't mean you shouldn't get vaccinated, but it does mean that you may not have as good of a response. If you are pregnant or breastfeeding, according to the CDC's guidance and the information with from the Moderna manufacturer, it is up to each woman to decide whether they get vaccinated or not, okay? The Moderna vaccine was not studied in the pregnant population, and neither was it studied in lactating women. The premise behind my statement is that each person has to weigh the benefit versus risk, and certainly the risk with COVID-19, as we've seen demonstrated, seems to outweigh the risk with the vaccine, receiving the vaccine. And finally, I just want to point out, again, you are receiving the Moderna vaccine today. Do not go get a second dose that is manufactured by another entity. So if a Pfizer product is available at that time, make sure you stay with the Moderna vaccine. Don't do Pfizer, don't take another entity. I know Johnson & Johnson is working on a product, and AstraZeneca. Moderna is your vaccine that you need to get for your second dose, okay? Now, I'm going to move on down to side effects. There are some side effects related to the COVID-19 vaccine, specifically with the Moderna vaccine. I want to read those to you, and I want to take you through a series of statements that are listed on the fact sheet for people who are receiving the Moderna vaccine and caregivers of people who are receiving the COVID-19 vaccine, specifically the Moderna product. You may have some side effects related to the site where you get the vaccines. It's going to be in the deltoid, it's going to be in the arm. You may have pain, swelling, and tenderness in the lymph nodes in the arm that you received the vaccine. You may also have swelling, tenderness, and redness in the arm that you received the vaccine. Okay? Those are the side effects that are listed here on the form that you all are looking at, and the ones that have been reported from the clinical trials. Other side effects you may experience are general side effects, and they include symptoms that sound similar to COVID-19. They're not as severe as COVID-19, and they do not include coughing, okay? So you may have fatigue, fever, nausea, vomiting, chills, and headache, muscle pain, joint pain. Those symptoms are possible with getting the COVID-19 vaccine. Now, those are side effects. I want to talk to you about adverse reactions as it relates to allergic responses. If you have difficulty breathing, swelling of your face, throat, or tongue, redness or rash over your body, dizziness, weakness, or an increased heart rate, those are indications of an allergic reaction. Now, we're going to watch you, observe you for 15 to 30 minutes after your vaccine today. But if you experience those symptoms after we observe you today, we need you to call 911 so that you can receive care for those symptoms, okay? That is very important. You will notice, and I will point to you in just a few moments on the fact sheet for emergency use authorization for Moderna, that there is a clause there that I want to refer to in regards to side effects. And basically what I want to say about that is the symptoms I just said to you are symptoms, adverse reactions, side effects that are related to the Moderna product. There is a statement in your emergency authorization paperwork on page 2. Don't flip yet. I'll direct you to that in a minute. But it says these may not be all the possible side effects of the Moderna 19 vaccine. Serious and unexpected side effects may occur. The Moderna COVID-19 vaccine is still being studied in clinical trials. So while I have read to you what is listed on the fact sheet from the manufacturer, you need to make sure you understand that that may not be every side effect that you may experience. Okay. Now, I want to talk a little bit about allergies, and then we'll move through the rest of your paperwork. So I mentioned symptoms for you to be on alert to after receiving the vaccine. I also mentioned the 3 absolute contraindications to receiving the vaccine. There are some things that make us want to observe you a little longer after your vaccine. The reason some of you will be watched for 30 minutes is due to the history information you gave us on your consent form. If you documented that you have an allergy to a medication by mouth that just caused maybe a rash or a localized response, maybe a rash or itching, maybe at a site of where medication was given, or if you experience GI or stomach upset or vomiting with a medication or a headache, that is not considered an anaphylactic reaction. So people who have allergies to medications will be watched for 15 minutes. I'm one of those people. I have an allergy to peanuts, augmentin, latex. I can be watched for 15 minutes and go on my merry way, okay? If you have had anaphylaxis to anything, and that's a severe allergic reaction with the symptoms that I named before, but let me name them again just for the sake of making sure that we understand. If you have had difficulty breathing, swelling of your face, throat, tongue, in response to taking a medication, if you've had an increased heart rate, if you've had a rash all over your body, any dizziness or swelling, dizziness or weakness in response to taking medication, we want to watch you today for 30 minutes. Having had a history of anaphylaxis does increase your risk for having an allergic response to any medication, and including the Moderna vaccine. If you've had an immediate allergic response to a vaccine or to injectable medications, you are also more prone to have an allergic reaction to this vaccine, so we will watch you today for 30 minutes as well. Okay. So now I want you to turn to the next set of papers that you have that I've referred to before, which is a fact sheet for recipients and caregivers of the emergency use authorization of the Moderna COVID-19 vaccine. The clause that I just quoted to you a minute ago regarding the side effects and that there may be some additional side effects than what's listed on your form, that clause is on page 2 of the emergency use authorization form, midway of the sheet. And I just want to point out to you where you can read that, okay? Now, I'm not going to read everything on this emergency use authorization form. That is for each individual to read and make an informed decision about getting the vaccine. I am just highlighting a few points that I want you to be aware of. In addition to the little clause on page 2, I want you to turn to page 4. This is important. After you receive your vaccine today, you may have questions later. You may have questions about the vaccine. You may have questions about, let's say if your little toe starts to itch and you want to know if that's related to the COVID-19 vaccine, you can look back at this fact sheet to see if that's listed. If it is not listed here, I want to bring your attention to the first link here on this page is the Moderna COVID-19 vaccine website. It is a website that will lead you directly to the manufacturer's website. It's a link that leads you directly to the manufacturer's website. You can scan that QR code with your cell phone and go directly to that site, or you can type in the web address in your browser and go to that site. Additionally, there is a CDC link and an FDA link. Each of these three will take you to additional information regarding the Moderna vaccine. This fact sheet that I'm sharing with you today is dated December 20th. Midway of this form on the first page is just a link to the updated versions of this form. I'm sharing with you the most up-to-date version of this form right now, but this form may be updated in the weeks to come, and we just want to make sure you have access to the link so that you can get to that. So I mentioned in that clause on page 2 that the Moderna vaccine is still undergoing clinical trials. In July of 2020, the Moderna vaccine entered into phase 3 clinical trials. And that just simply means that they had people in the study, and they had 30,400 plus people involved in that study. They had a placebo group, and they had a group that actually received the vaccine. They learned 2 things from that study. One, that the vaccine has side effects, like many vaccines do. The second thing they learned was that the vaccine is effective, which is why we're trying to get it now before it has full FDA approval. I want to encourage you all to participate in something called VSafe. 30,000 people is a lot of people to be engaged in a clinical trial. However, when you think about the millions of people that need to be vaccinated and the broad range of demographics that they have, their ethnicities, their race, geographics, we don't have a lot of information. We have enough for 30,000 people, but it's not enough for millions of people. The CDC and the FDA has recognized that, and they have created something called VSafe. This is an app that you can access on your smartphone. You can scan the QR code that's on the back of the sheet, and this is the last sheet in your packet that you have. You can scan the QR code on the back of this form, and it will take you directly to the registration site to register for this app. This is the CDC FDA's post-COVID-19 vaccination health checker system. What this will do for you, once you register, they will send you a text every week for 5 weeks after today's dose. And they're going to send you a link to a survey. You just simply click on that link in the text, or they may email it if you don't have a smartphone. You click on the link that's provided in your email. You will go directly to a survey and they will ask you several questions. It will take you about 5 minutes to complete the survey. They will ask you questions about the symptoms that I just explained to you, but they may also ask you if you've had COVID-19 infection. Why do they want to know this information? Because it helps build to the wealth of information that we already have about the COVID-19 vaccine and how we are responding to it. This is not specific to Moderna. This portal is being used to report reactions for or symptoms or the lack thereof to the Pfizer product and other products as they become available. This data will help our public health professionals who are working in research in the public health science of determining and adding to the validity of what's being reported right now in terms of safety and efficacy of this vaccine. So we are asking everybody who gets the vaccine to register for this app. Okay, the final thing I want to say, I said that the clinical trials taught us two things, that it had side effects, that the vaccine had side effects, and that the vaccine is effective in preventing symptomatic COVID-19. It is 94.1% effective in preventing symptomatic COVID-19 disease. What does that mean to us? It means that we want to get the vaccine because we don't want to get COVID-19 infection, right? But it also means that it's not 100% effective. So while you get this vaccine today, we need to keep practicing our 3 W's. I'm only sitting here without my mask because I'm spaced more than 6 feet away from anyone. But we need to continue wearing our mask. We need to continue washing our hands and sanitizing our hands using our hand sanitizer. We need to keep waiting 6 feet apart when we go into public spaces. We need to avoid crowded places. And we need to continue, in summary, practicing social distancing. We have communicable disease precautions that have been taught to us or in the media from the state, from the government, from the CDC. We need to keep doing the common sense things. Your body will begin mounting a response to the vaccine in 2 to 3 weeks from your first dose. Your response at that point will not be at 94.1%, or excuse me, your response will not be such that in 2 weeks that your immunity will be at 94.1%, okay? 2 weeks after your second dose, you will hit that theoretical 94.1%, okay? However, I will say again, it's not 100%. So in addition to continuing to practice our 3 W's, we need to also, if we come in contact with someone who has COVID-19 infection, we need to still quarantine. We need to quarantine and follow the guidance from our communicable disease and public health professionals, guidance and advice that you receive.